Hi, everyone. First of all, let me thank the organizers for inviting me to this very, very interesting meeting. And it's really a great pleasure to be among great colleagues and friends, and really glad to be here. So I would like to spend the next few minutes discussing the concepts of healthy Mediterranean diet, which is pretty much a very well-known concept. But I want to take this a little further and include in that the other pillars of lifestyle medicine, which of course you know very well who they are, in order to change the Mediterranean diet into a Mediterranean lifestyle concept. And I would like, as I'm doing that, I would like to incorporate the results of an international symposium that we uh, did last year in the island of Leros in Greece, with the sole purpose to define Mediterranean lifestyle. Definitions, play a major role because they determine how we go about studying this specific term. So in the case of Mediterranean diet, unfortunately, we still don't have a universally accepted definition. And that has caused many problems in terms of how we, the types of studies that we have done in this area. We don't want that to happen with the Mediterranean lifestyle. So we tried to, putting together a very large team of experts from around the world. They worked together for several months, and then we went to the island of Leros last summer, in the summer of 2023, and we came up with a definition of the term Mediterranean lifestyle, which I will present to you towards the end of this presentation. So first of all, let me say that I have no relevant or material financial interests. So Mediterranean diet, very well-known concept. I don't need to discuss this at any length. But in general, we accept that it's a dietary pattern that has been adopted in the olive growing areas of the Mediterranean region. It was always there, of course, but in the late 50s, it's when it was recognized by the scientific community as a healthy paradigm. Plenty of scientific evidence to suggest that this diet is very healthy and good for you. However, it cannot alone fully explain the superior health and the longevity that we have observed over the past, 80 years now with different studies, or maybe 60 years with various studies in the Mediterranean region. In other words, the superior health of these people living in the Mediterranean region cannot really accounted fully by the health benefits of the Mediterranean diet alone. So if it's not only the diet that gives those positive results for those people, then what else is it? So in order to study this, many scientists have tried to look into other factors that we know affect our health and longevity, morbidity, and mortality. One of those examples, and a prime example actually of this type of studies, is the so-called Icaria study. This is a study that was spearheaded by the University of Athens in Greece and Harkopio University. So this study, went to the investigators. They visited the island of Icaria several years in a row, and they examined the lifestyle and also health indices of the people that live there, especially the older adults. And they have come up with some very, very interesting observations. The first is that these people have, up to a very old age, they have adapted a very physically active lifestyle. And when we say physically active, we don't mean exercise the way we understand it now in the Western world, meaning you have to go to the gym, you have to do 30 minutes on the treadmill, then you do a few sets of weight lifting, etc. We're talking about activities of daily life that are mostly associated with producing something, not just working for no reason, but working in your fields, working in your garden, uh, taking your kids or grandkids to school, go and swim, etc. And from the pictures here, you can see two examples of people that really at an old age, they go and work. One important thing here is also that many of those people, they don't actually have to do that, but they enjoy doing it. And that's a very important distinction between labor that you have to do to perform versus work that you actually enjoy doing. The next thing that they also realized there was that there was a sense of purpose in life in those people. That could be either helping the family with the kids, if these people are older and they have grandkids, or working in community projects, simple projects. We're not talking about any grandiose ideas here. Or in this case, like in this picture, helping refugees that they came to these islands. This is from the island of Lesbos, where a few years back there was a very big problem. People were facing huge challenges because a very large number of refugees came to this island, and the islanders were called for help. So the purpose of life was something that it was prevalent in this area, and you really did not have people that they were bored or they did not have things to do in the morning. Most people, they would wake up, like I said before, either to care of their grandkids or go to their garden, tending their garden, tending their fields or the livestock. The optimistic attitude towards life was something else that also was very obvious and prevalent in this society. Even though those people are not living an easy life the way we understand easy in the Western world where we need to have everything available at all times of the day, all year round, etc. These people, most of these people are people that have worked hard in their lives, and now towards the end of their long lives, they tend to enjoy and they look at the remaining years with an optimistic eye. The prevalence of depression is very, very low in this area of the world, and that, of course, is another factor helping them to look at life with this optimistic eye. These people live a simple life, so stress levels are low, and these two things go together most of the time. The simpler your life, the less stressful it is. But something that is really unique to this island, even amongst other islands in this area of Greece, is that any chance they find, those people are using it to start a dance or a singing event, a dance event that is now famous all over Greece or all over the world, and many, many people go there in the summer to partake to one of those either organized or events that happen randomly when someone in the cafe starts singing or starts dancing. Of course, the diet, the Mediterranean diet, what else can it be over there? Mainly because people are using whatever their land produces. And this is, of course, the characteristic of the Mediterranean diet. The people in this area did not adapt this type of a diet because they knew it was a healthy diet. They were just eating whatever was available in this area. And what's available here is lots of olive oil. We don't have any other type of oil in this area. And of course, greens and vegetables and fruits and whatever else this land is offering. However, nutrition and Mediterranean diet is not only the type of food you're eating, it's much more than that. It involves the way you are preparing the food and, most importantly, how you consume the food. I don't care if you eat the best diet in the world, the healthiest, if you eat it alone in front of a TV, depressed, it won't do you any good. It would be better if your diet is, let's say, a little more inferior in quality, but you're enjoying it with good friends, far away from toxic people that might actually increase your stress and also affect your metabolism. So these people, they tend to eat whatever the land is producing and also eat it together. Family is very, very strong in this area. Midday naps, common in the whole of Mediterranean region. It is something that even by law in Greece and Italy and other places around the area, it is something that even the law protects this lifestyle. So a midday nap was always carried out because in the middle of the day in the Mediterranean region, it was very difficult to work, especially in the summertime. So people would take a break, and this is now, even now it's practiced, especially in smaller cities. Most stores close around 2 o'clock in the afternoon, and then they reopen around 5. And those 3 hours, people have the chance to go back, eat with their family, the conviviality that we mentioned before, then take a break, take a nap, and then go back. And we now know that taking a nap that would last from between 20 and 30, 40 minutes, it is really it has significant health benefits. Alcohol consumption, we've heard many things about alcohol lately. What we know about the Mediterranean region is that people in this area, they tend to drink always, mainly wine, because this is what they produce there, and spirits like tsipuro, or tsikoudia, or raki, or arak, as they call it in different parts of the Mediterranean region. However, this was mainly with meals, lunch and dinner, not breakfast, and with good company and friends. And this way, moderate alcohol drinking, mainly wine, has been associated with significant health benefits. Participation in social groups with common interests is something that is very, very common there. People have very strong social ties with the villagers, with others in the area, and of course, family. But the important thing here, and I mentioned that again, is that they really use every chance, a wedding, a baptism, even funeral sometimes, to really start not only socialize, but enjoy life with dancing and singing. Companionship and avoidance of isolation, a very, very common thing here. You very rarely find people that they live alone. Kids, they would take their parents, especially if one of the two is gone, is deceased, they take them to live with them. And it's very uncommon to see old people living alone in this area of the world. However, it's not only the family, but it's the friends and this everyday connection with people that you really like being with, even with people that you like to argue, but it's something that you do in a good spirit and something that you enjoy and look forward to it. We know now that social isolation is really a killer for, it would increase your chances for developing all kinds of diseases, physical and psychological. Family ties, very, very important, not only because people have good relationships, not everyone has good relationships with their parents all the time, but also because of need and because of proximity. People tend to live nearby, and the chance is there for the grandparents to participate in the upbringing of the children, of the grandchildren, which is also a financial help for the young couple not to have to pay for daycare. So, as I mentioned before, in June of 2023, 40 experts from 29 countries and from 12 lifestyle medicine professional organizations came to Labros with one mission: to develop the definition of the traditional Mediterranean lifestyle. For the 7 months before that date, these people, divided in 6 groups, searched the literature for the definition of the traditional Mediterranean diet, Mediterranean physical activity, Mediterranean stress management, Mediterranean sleep hygiene, socialization, and substance use and abuse. So we met in Labros. This is where the headquarters also of the Mediterranean Lifestyle Medicine Institute is. It's an institute that was started almost 2 years ago now, back in 2022, and the sole goal was to research, and if the evidence is there, to promote the Mediterranean lifestyle as a healthy lifestyle for people to follow. During that meeting, we were practicing what we are preaching and what Mediterranean lifestyle is all about. We were practicing even more, and of course, we were doing also some work at the conference center where the results of this 7-month work were presented. And also, most of the work actually happened in the yard among the olive trees. And after we started meeting there, no one wanted to go back to the conference center. So in smaller groups, we discussed the findings of each of the task groups, the 6 task groups that examine the various pillars of lifestyle medicine. And then, of course, some more practice, enjoying the beautiful islands in this area of Labros. Next to it, you have Kos, you have the islands of Lipsi, Arki, Aspronistia, etc. It's a great, great area to visit and enjoy life. And of course, some more practice with cooking, the Mediterranean cooking with a local expert. So what is the traditional Mediterranean lifestyle? What did all this work came up? What did it produce? Produce the following definition for the Mediterranean lifestyle: is a diverse and adaptable way of living. Key aspects include conviviality, social connectedness across the lifespan, a purposeful life, a strong sense of community and family values, connection with nature and the lived environment, deep-rooted spirituality, religious practices, local customs, acquired resilience through adversity, and a sense of moderation in all aspects of life. So this is a definition that we all agreed on, again, based on 7-month work, reviewing all the available literature from the ancient times. We focused on the 3 great civilizations of that time in the Mediterranean region: the Roman, the Greek, and the Egyptian, and also, of course, the modern literature up to approximately 1970s, because what we are defining here is the traditional Mediterranean lifestyle, and unfortunately, this is different than um, the contemporary Mediterranean lifestyle, which has obviously changed, uh, affected, since it has been affected by the more Western type of living. So, what is next then? Okay, we defined the Mediterranean lifestyle. Now we need to go back and start working again because we do have enough evidence to suggest that the Mediterranean diet is healthy and leads to long and healthy lives. But the evidence for the Mediterranean lifestyle as a whole, in a holistic manner, it's not there yet. So the goal of the second symposium of the Mediterranean Lifestyle Medicine Institute, which will take part in June 5-8 of 2024, is exactly that, is to explore the health benefits of the traditional Mediterranean lifestyle, what we know, what needs to be done, which will also guide us into what we have to do in order to cover any gaps that exist in the literature and come up with an answer to the question, is the traditional Mediterranean lifestyle a healthy paradigm that we can propose to people all over the world to follow in order to improve their lifestyles? Thank you very much for your attention, and I hope to see you in the future in one of our conferences organized by the Mediterranean Lifestyle Medicine Institute. And if you wish, please visit our website that you can see here on your screen. Feel free to check the website, see what we're doing, and if you're interested, just go ahead and become a member so you can receive all the information for future events. Thank you very much. Please stay relaxed, happy, and try to do everything in moderation.